Hello, welcome to the last episode in this series, mental health series. And so today we'll be talking about various mental health conditions. So when we talk about mental health condition, it's not a form of death sentence. Like if not properly managed, is when it becomes so complicated and then categorized as something so harmful and could lead to death or whatsoever. But if appropriate measure is taken early and on time, you might be able to cope whatever kind of complications that may be coming from your mental health condition. Yes, because everybody goes through stress during one phase or the other in their lifetime. So the first one we're talking about is anxiety disorder. This anxiety disorder, yes, everyone gets anxious, but when it becomes something that occurs to you so often, like there is no situation, like there is nothing bad happening around, but you tend to have this kind of worry about something, and then you are worrying that something might go wrong when something is necessarily not even going wrong, then it's the kind of condition you need to pay attention to that might be harming you. This becomes a mental health condition when it lasts for like few days and even goes into weeks. Then the second one is depression. This one is a very common kind of mental health condition, and at times it leads to other complications whereby such individual tends to commit suicide. So what is depression? Depression is a kind of condition that occurs in the sense that this individual tends to become so sad. They feel worthless. They feel like life doesn't have any meaning anymore. They feel stressed of life. They feel tired of themselves. They feel like they are not necessarily supposed to be existing. One of the common signs of depressed individuals are those kind of people. You find them, this moment they are laughing, smiling at people. Then when you get closer to them, you see them to be in this their kind of shell, trying to tend to be kind of dismissive, expressive, like they don't want people around there. You find them overwhelmed in their thoughts, lost in thoughts. You find them disconnected from people. They just try to pretend to show up, but at this moment they are trying to get away from people. These people are suffering from depression. One way they even suffer from it, and it becomes so complicated, is when it's normal for people to pass through those things as a result of some kind of stress. It could be financial stress, it could be emotional stress, it could be a kind of traumatic stress. Yes, that is well understood. But when it progresses to few days, 2 weeks, then appropriate measures is needed to be done. If not, it could be deadly. Then another condition is bipolar disorder. You find this kind of people, at this moment they are so excited. You just see them overly excited, high energy. Then at this moment there is this kind of low energy. Then you see them alternating this mood differently. The same persons, but this different mood. Then those individuals are suffering from a mental condition known as bipolar disorder. Yes, it might not necessarily be harmful, yes, but in the sense whereby you have someone that's experiencing it and you see the way they behave, that they could actually harm themselves. More reason why you need to pay attention to them and help them out in whatsoever way it is. And one of the ways you help them out is to make sure they reach out to necessary care provider for them, such as psychologists, therapists, psychiatrists, and whatsoever it is, depending on whosoever they are being referred to. Another condition is PTSD. This is very common, which is known as post-traumatic stress disorder. This kind of condition happens whenever someone passes through a kind of traumatic experiences, which could be as a result of maybe accidents, past histories that mirrored their image, or a kind of domestic violence, or a kind of abuse, or a kind of situations that put them in such a painful, in such a grievous situation, and they cannot get rid of those experiences so fast. It could be maybe they lost someone so dear to them, and it becomes a kind of trauma to them. And so after they must have gone through those periods, those phases whereby they experience those bad events, then you find out that they tend to find it difficult to relieve themselves of those events. And such individuals, they are those kind of individuals that you tend to just find them lost in thought. You tend to find them shedding tears. It could be as a result of them remembering those events, and it is affecting them at that moment. And so this is why it is called a post-traumatic stress disorder, and it's also a mental health conditions that need to be managed, because for some it is inevitable. They pass through those events, and those things are still stuck in their memory. So it's one thing, they need show of love from people around them. They need to pass through some kind of therapy that will help them erase, not totally erase, but at least forget those events that comes to their head and makes them to get into some kind of bad situation at that point in time. And the last but not the least is somatic symptom disorder. This kind of disorder is funny in the sense that you tend to have some kind of symptoms that looks like you are really sick, or such individual is ill, but after going for tests, after going to see your doctor, they say you're fine, but you still feel a kind of pain, you still feel tired, you have this stomach pain, diarrhea, and then you're wondering what's going on. This is a kind of mental health condition that may be associated with some kind of things that happen to you. At times it might be a kind of emotional shift or a mental health stress, and what you need to do is just to monitor whatsoever may be triggering those symptoms. Monitor the period whereby you're having those symptoms. What are the circumstances that surrounds those moments whereby these symptoms tends to manifest? This is another way you could dismiss it, or you could monitor it as a mental health condition that needs you to see a therapist, needs you to see a psychiatrist or a psychologist, or whosoever you might be referred to from your healthcare provider. A period whereby you find out, or you have someone and you find out that these symptoms occur more often, like they last for days, like a week, 2 weeks, then you should take appropriate measure immediately to seek the doctor, and then doctor refers you to the appropriate professionals that would handle such condition. In the moment whereby you feel this person needs to seek help is whenever it starts to affect work. It tends to affect your relationship with people. It tends to affect the way you view the world, the way you live your life. Then you need to see a doctor. Then another moment whereby you try to use some things that would maybe help you forget, or help you, or want to relieve yourself temporarily of your feeling at that moment. Maybe try to use alcohol, try to stay away from people, try to just be out there, just trying to forget, distract yourself so much. Then you are doing all of these things often, like frequently. You should know you're suffering from a mental health condition. You need to pay attention to. One thing we need to understand is that a lot of people don't own up to themselves that they are suffering from mental health condition, because in some parts of the world, whenever you're suffering from a mental health condition, they tend to believe you are being accused, or you're facing a kind of spiritual problem, whereas you just need to check out yourself. You just need some kind of help that will help you walk out of that situation or that condition you find yourself in. So this is more reason why you need to own up to your conditions. Speak to trusted people, speak to your healthcare provider, tell them how you feel, tell them what you're facing, so they can be able to help you appropriately, so that you live your life at its best. Remember, health is wealth. I hope you're able to learn one or two things from today's episode. Please don't forget to like, share, and make your comments. Please subscribe to my channels to enjoy more health topics like this. Bye.